Ma'am, we are live now. With all your permission, I'm starting this session.
Yeah, sure.
A very good evening, everyone present here. I welcome all the participants on today's session. Let's welcome today's speaker with great honor, none other than Dr. Ritu Santavani ma'am. And let me share some of the achievement of the ma'am. Ma'am has done MBBS, MD in obstetric and gynecology, founder and CEO of Shyam Well Women Clinic and 360 Healthcare Studio in Koregaon Park, Pune. And today she is going to speak on a topic HVP vaccination, confusion to clarity. And before starting this session, let me tell you overview of the topic. As we know that this webinar will highlight the often misunderstood topic of HPV vaccination. Human papillomavirus PVV is a common sexually transmitted infection that can lead to serious health issues, including cervical and other types of cancer. To more know about this topic, I would like to invite ma'am and hand over this session to ma'am. Over to you, ma'am. Kindly proceed from here.
Thank you, Farah, and thank you, IGCP MedTalks, for inviting me here. I had taken earlier also a lot of sessions here. So, friends, first of all, thanks to all of you and warm welcome to all of you, those who have joined today here. I know the OPD timing is this, and each and everyone is busy for the Diwali celebration, Diwali, which is the biggest festival of the India. So now I am directly going to the topic. So friends, today's topic, I will move on the slides. First, I want to give a little introduction for the topic. So the topic today, what I am going to discuss today is the HPV vaccination from confusion to clarity. So here I could make the slides, what the slides I'm going to show you, only what are the questions we are getting in our daily practice. I have not put any other thing for the literature, only what are the questions, what are the difficulties we are getting related to this HPV vaccination in our OPD. So thank you Faraz for the introduction. My all presentations will start with Mata Durga Stuti. या देवी सर्वभूतेषु चिकित्सा रूपेण संस्थिता नमस्तस्यै नमस्तस्यै नमस्तस्यै
Ma'am,
नमो
sorry to
नमः.
interrupt, ma'am.
Yeah,
Your screen
yeah,
is not shared, ma'am. Could you please share? Like your screen is
it's
not
not
visible.
shared.
Yes, ma'am.
Achha, again, I will then. Why it is not shared? I thought it. One minute, I will close and then I will share again. Okay. Now, Parag, it's visible?
Yes, ma'am. It is perfectly visible and full screen.
Yeah,
You can proceed.
yeah. Thank you, thank you. So friends, as just we have introduced the topic, that today I am going to, the topic for today is what is from confusion to clarity related to this HPV vaccination. So what are the frequently asked questions? What are the frequently asked queries? So friends, as we know, for this, that how can the HPV infection can be prevented? So as we know, for this screening of the cervical, just I will show. Screening for the cervical cancer, as per CDC guidelines, routine screening for women in the age group of 21 to 65 years can help prevent the cervical cancer. And HPV vaccine is very well tolerated and demonstrated to help protect against the HPV related infections and diseases caused by the HPV vaccine types when given in the recommended age group. Safe sexual practices, being in a mutually monogamous relationship and using condoms during the sexual intercourse can help provide some protection against HPV infection. Why the slide is not moving? What happened? So again, the query comes that which kind of HPV vaccines are available in India? Hmm. So, friends, as we all know, the bivalent HPV vaccine, the quadrivalent HPV vaccine, and the newer one, the 9-valent HPV vaccine. So, friends, earlier, once this vaccine was introduced, the lot of us has given only the two brands were available at that time, the Cervarix and the Gardasil. Now, I don't think the bivalent is still available because earlier that was covering only the 16, 18, and the quadrivalent is covering the 16, 18, and 6 and 11. The 6 and 11, which was covering the additional protection for the wards. Now, recently, this nanovalent vaccine has been introduced. Just a second, I don't know what happened. So, so now the question comes, do all the HPV vaccines offer the same coverage against the HPV infection? And as we all know now, some other companies has also come with the Indian brand also has come for this protection for the HPV vaccination. So as we know, this bivalent vaccine gives the protection from HPV 16 and 18, which is causing the 70% of the cervical cancers. Mhm. Then quadrivalent HPV vaccine, of course, it giving the additional protection from 6 and 11, which is causative agent for more than 90% cases of the genital warts. Mm. Then the nanovalent vaccine, as I told, the 6, 11, 16, 18, and additionally 31, 33, 45, 52, and 58. So these are the some oncogenic strains of the HPV which has been reported in the literature, which are having the more causative agents for the cervical cancer and the genital warts. In my private practice, I have seen a lot of patients infected with this HPV 58. So the next query comes that who should we get vaccinated against HPV? So what are the guidelines has come for the dosage recommendation by Foxy and IAP? So friends, in the females, all the females starting from the age 9 years of age group should be vaccinated. The quadrivalent vaccines is licensed for the use from the 9 till 45 years of age group, while the nanovalent vaccine is licensed for use from 9 till 26 years in females and 9 to 15 years in males. Again, I'm repeating because for related to this, lot of queries are coming by the some doctors also that why can't we give this vaccine up to the 45 years as the quadrivalent vaccine we give from the age group 9 to 45? Because friends, what the studies we are available for this 9-valent HPV vaccine is from 9 to 26 years is available for the females and 9 to 15 years in the males. While for the quadrivalent, we are giving in both up to 45 years of age. But what the studies we are having, what the data we are having is from 9 years to till 45 years in females. Then again, the another query comes that can we give this HPV vaccination during pregnancy? Yes or no? No, friends. In the These vaccines are not recommended for the use in the pregnant women. Limited data on the safety of HPV vaccination in pregnancy, as per various clinical studies conducted, no specific safety concerns were identified for the outcome of pregnancy, spontaneous abortion, miscarriage, stillbirths, or fetal development. Being an infertility specialist, I'm getting a lot of patients who are coming to me for the infertility treatment. And once I advise them for this protection from the this HPV virus to take this vaccine, the only one query the all the patients are having, ma'am, if we conceive, we can't, as you told, we can't take this vaccine. So post delivery, is it like that we have to take again all the 3 shots? No. So whatever the doses are remaining, only that shots they have to take. Uh, as usually, the protocol we are following the 0 to 6. But suppose if the patient has taken the vaccine accidentally in the pregnancy, no need for the termination of the pregnancy and no such adverse effects has been reported. In the absence of a well-controlled studies in pregnant women, HPV vaccination is not recommended in pregnancy. So, what should be done if the female finds out if she is pregnant and has received the HPV vaccine? So, what are the guidelines has been suggested? As I just told, the remaining doses of the vaccine should be withheld and can be given 6 weeks post delivery. If the pregnancy occurs following the first dose of the HPV vaccination, the subsequent dose should be delayed until the pregnancy is completed. The termination of pregnancy is not indicated if the vaccine was carried out inadvertently during the pregnancy. So there are a lot of studies, friends. These are the very recent studies which has been reported in 2020 only. Then for this WHO position paper in 2022. And what this I posted, it is posted in WHO internal team immunization paper, which is presented in 14th March 2023. Then another query comes, is the HPV vaccine is safe for the people who are immunocompromised and or are infected with HIV? So friends, what's your opinion? The studies have shown for this HPV vaccination of immunocompromised person, the safety, immunogenicity, and efficacy of quadrivalent HPV vaccine has not been fully evaluated in immunocompromised individuals. The immunologic response to HPV vaccine may be diminished in immunocompromised individuals, so that's why it is not recommended in them. Then the another query comes, can the breastfeeding, the lady who is the breastfeeding the baby, can she receive the HPV vaccination? Yes, we can give. So breastfeeding is not a contraindication for HPV vaccination. Evidence from clinical trials suggests that HPV vaccines generally do not affect the safety of the breastfeeding mothers or their intents. There was a study was conducted amongst this 1133 women who are breastfeeding for this. So vaccine immunogenicity was compared among the nursing mothers and the women who did not nurse during the vaccine administration. The rate of adverse experiences in the mother and the nursing infant were comparable between the vaccination groups. So again, the study, common query comes. Friends, I have made this presentation only what are the common confusions we are having in our daily day-to-day practice. That's why I've kept the topic heading is, so it's what is from confusion to clarity. So do sexually active people benefit from HPV vaccination? So HPV vaccination may help benefit the sexually active individuals as well. It can help to prevent the acquisition of new HPV infections for the strains that the vaccine covers that they have not been exposed to. A randomized placebo trial phase 3 was carried out to evaluate the efficacy, tolerability, immunogenicity of the quadrivalent HPV vaccine in the adult women. Females who had previous infections or exposure to HPV may benefit from vaccination with the quadrivalent HPV vaccine. So, a lot of studies are in the favor of this has been presented. So, should an individual who is infected with HPV vaccine can still get the HPV? Should the individual who is already infected with HPV can still get the HPV vaccine? Yes. People who have HPV infection and or an abnormal pack test should still receive the HPV vaccine if they are in appropriate age group. The HPV vaccine may help protect the individuals infected with HPV against high-risk HPV types that they have not yet acquired. The vaccination does not cure the current HPV infections. So, what are the current doses recommended for this HPV? So, friends, here we can see the studies have shown for the age group females 9 to 14 years, the two dosage schedule 0 and 6 months. For 15 to 45 years, 0 to 6. And for this Gardasil 9, for 9 to 26 years, and for the males 9 to 15 years. What the dosage schedule has been recommended is 0 to 6. These days, a lot of other protocols has also been come. Some are recommending that from 9 to 20 years, if the female is coming, when the chances of the STDs are less, as the girls are not sexually active. So in they are recommending for the single dose or maybe the two dose or the single dose for also, but still the studies, not enough studies are in the favor of that. Only what is important, what these studies has come. Again, I'm repeating that for quadrivalent from 9 to 14 years, the two doses schedule 0 to 6. For the 15 to 45 years is 0 to 6, and for the 9 to 14 is 0 and 6. For this 9, which is recommended for 9 to 26, 0 to 6 schedule, and for males also 0 to 6 has been reported in the literature. Why the vaccine is recommended at such a young age? Vaccination is a key to help prevent against the HPV related diseases. HPV vaccination prior to 15 years of age results in 2 times higher HPV antibody titers when compared with vaccinating at the 15 years of age or older. So earlier vaccination helps to provide the higher reduction in the lifetime risk of the cervical cancer. Who should not receive the HPV vaccine? Those who have a life-threatening allergic reaction or to any ingredient of an HPV vaccine or to a previous dose of HPV vaccine, the pregnant females, people with a moderate or severe illness should wait until they are better. What should be done if the dose is missed? What are the FOXI guidelines suggest? The HPV vaccination series should not be restarted if there is an interruption in the vaccine schedule or delay in between the doses. Only the remaining doses should be administered when the recipient is willing to complete the schedule. Can HPV vaccine be used interchangeable with one another? There is limited evidence regarding the safety and efficacy of HPV vaccines when used interchangeably with one another. The available vaccines may contain different components. Every effort should be made to use the same vaccine for every dose. So this is also very important. Then other query comes, can the HPV vaccine be administered concomitantly with other vaccines? So yes, friends, it can be administered concomitantly at the separate injection site with the following inactivated or live vaccines: with the meningococcal vaccine, with tetanus toxoid, with diphtheria, tetanus, acellular pertussis, and polio vaccine. Concomitant vaccination of HPV vaccine with these vaccines has not been demonstrated to compromise the tolerability or the immunogenicity of the individual vaccines. Is the HPV vaccine is well tolerated? The HPV vaccine is usually well tolerated. Only the some side effects which has been reported at the injection site, the redness, pain, swelling, and systemic adverse effects such as headache, fever. In some patients, it has been reported. So, what are the some myths related to this? The natural HPV infection already creates a protective antibody response, so there is no need for the vaccination. So, friends, to clarify this, HPV does not enter the body circulation and does not cause the local inflammation, so antibody response is low to absent. Natural immune response is insufficient to control the new infections. So also it is far lower when compared to higher levels of sero response and the higher efficacy observed against the persistent infections after the HPV vaccination. Infection with one type of HPV may provide some protection against that one particular type, but it will not provide protection against the other HPV types. So again, another myth comes, is the HPV vaccine protects only against the cervical cancer? So high risk HPV are known to cause the cancer cervix, vulva, vagina, and anus. HPV vaccines have demonstrated to help provide more than 95% protection against the infections and precancers caused by certain types of HPV. Administering the vaccine to boys and girls between the age group 9 to 12 years of age can help to prevent more than 90% of certain HPV related cancers when they get older. So again, the other myth has come. The pap smear are sufficient to prevent HPV related cancer. So one of the way of the primary prevention of cervical cancer, which helps in avoiding getting the HPV infection. So the cervical cancer screening is mandatory even though if you have taken the HPV vaccination as per the guidelines. So friends, what the studies have shown, we can go for this last one. The HPV transmission from the females to males is higher than the males to females. So males remain susceptible to HPV infection throughout their life, and male experience the higher rates of the genital warts. Absence or approved routine HPV screening may increase the risk. So another study's myth has come, the effectiveness of HPV vaccine decreases over time. So friends, what the studies have shown, this quadrivalent vaccine, the studies have shown the effectiveness almost 100% more than 12 years, and with the trend, what the studies have come towards the protection throughout the 14 years of the post-vaccination. While this 9-valent HPV vaccine helped to demonstrate to provide the durable protection against the HPV infections and diseases caused by the HPV types throughout at least 8 years vaccination in girls and boys in the age group of 9 to 15 years. So again, the other myth has come that this vaccine contains some harmful ingredients. So this has all the vaccines has been well tolerated. They contain the aluminium like the hepatitis B and Tdap vaccine, which helps to boost the body's immune response to the vaccine. So a lot of studies have come that aluminium containing vaccines has been used for decades and has been administered to more than 3 billion people. A lot of studies have come in the favor of this. This vaccine can cause the fertility related issues, a very, very common myth in the public mind. So documented evidence for the clinical trials demonstrate that HPV vaccines do not cause any reproductive problems in women. Another method, vaccine can transmit the virus and cause the cancer. HPV vaccines are usually made by using the recombinant technology. So they do not contain any live biological material or viral DNA. Therefore, they are non-infectious. So these are the common queries what we are having. What are the only one last slide I want to show. After that, we can take for 2-3 minutes some question if is there. So what are the common concerns regarding the HPV vaccination? I worry that HPV vaccine may not have the real benefit and may in fact causing the lasting health problem. Totally a myth. Why does my son needs the HPV vaccine? Can HPV infection be avoided by simply by using the condom? Another common query, once the lady is coming with her daughter, once we advise to take them for the vaccine also, the children are not sexually active. So why to vaccinate them against something that does not concern at this age? Does getting vaccinated encourage the promiscuity? Is the pap test is still needed after the vaccination? If yes, then why it is needed for vaccination? What is the need for the vaccination? So these are the some common myths with which the patients are coming to us. So I tried to clear all this. So due to the paucity of the time, friends, I can't take the furthermore. So these are actually usually the common queries which each and everyone is having in a mind while we are giving this HPV vaccine. Meanwhile, Faraz, if we have received any questions, I am ready to answer.
Okay,
I'll
thank you
just
so much, ma'am, for giving your valuable time from your busy schedule, ma'am. It's very impactful for sharing the knowledge, ma'am. Let me check. We
thank
have received one question, ma'am. Like there are a few questions. We will be taking the first question. The question
yeah.
is from what are the most recent development in HPV vaccination and how have they impacted clinical practice?
Huh. So yes, I have just shown this presentation on this. The recently what we are having the nanovalent vaccine also, and recently only the price with this vaccines with the price is little higher side. The one shot is going for the 10,850 is the MRP. So only the cost is the major factor for protection from this nanovalent, taking this nanovalent vaccine, because each and every patient is coming and telling, ma'am, यहाँ तो 11,000 वैक्सीन में ही निकल जा रहा है मेरा, that is for the one shot. So now the another company has come with the another vaccine which is also containing the only the four viruses, but still the nanovalent viruses is still only by the one company, but only the main factor is the cost is little high. And the dosage schedule already I have shown. Those जिन्होंने भी question पूछा, they can go through the earlier presentation. So this is the reason only we have to properly counsel the patient.
Okay, thank you so much, ma'am, for answering it really well. We will be taking last question from Dr. Subramaniam. He's asking, what is the role of new technologies and telehealth play in promoting and administering HPV vaccination, especially in remote and under-reserved areas?
Very nice questions. Very nice question. Huh? Dr. Subramaniam says there's a lot of role of the technology. When we were studying at that time, the technology, the internet was not as great as now. What the advantage of the Gen Z is having, and what there is a lot of advancement with the AI. With the AI, we can reach, and with the internet we can reach up to the remote areas also. Anganwadi workers, asha workers, they all can be taught about the teach about this vaccination, and from the school education only they will be aware. And this vaccine can be included in the national immunization program also, as in the some other countries it's already going on. So earlier the better, and prevention is always better than cure. So I think with the technology, we can create a miracles, miracles.
Thank you so much, ma'am, for
Yeah.
again answering and making the clarification on this. As we know that now we are living in the digital world, and
Yeah.
the earth has become global village. Everything is far. Once we can communicate and share the knowledge, it is very impactful. And thank you so much, ma'am, for giving your valuable time and sharing your knowledge on this topic, ma'am. As we can see, ma'am, there is no more question. With all your permission, shall we conclude this session?
Yes, yes, yes. Thank you. Thank you, Farah. Thank you, IGCP, for inviting me here.
Okay, thank you so
Bye-bye.
much once again, and
Yeah.
hope to see you again with different topic in futures, ma'am. Bye, ma'am. Take care of
Bye,
yourself.
bye.
Good night.
Sure, sure, sure. Good night.